Hello, and welcome to Niagara Region Public Health's COVID-19 website. We've recently given some of our pages a fresh new layout in response to feedback from Niagara residents. The pages have been redesigned for further clarity, accessibility, and ease of access to key data. Let's walk through it together. If you scroll down to COVID-19 reporting on the right side of the page, you'll see 4 links: daily and active cases in Niagara, Vaccination Statistics, Provincial/Monitoring Indicators, and Epidemiological Summary. Let's start with daily and active cases in Niagara. On this page and on each of the others, you'll notice a question mark icon and the word help. Here you will find an overview, definitions, and data sources for that particular page. The overview explains the purpose of the page, includes information about data sources and refresh times, as well as a how-to-use guide. If there's information on the page you don't understand, the Definitions tab helps explain what something means. The Data Sources tab provides each of the data sources for the information you find on that page so you know exactly where it comes from. Select Close to go back to the page you started on. At the top of the Daily and Active Cases in Niagara page, you'll see the overview of case and death statistics for the Niagara region. The page also provides statistics such as active case count by municipality, total cases by age group, an outbreak overview, and more. Just below the outbreak overview at the bottom of the page, there's a link to visit the Healthcare Facility Outbreaks page for more information about active COVID-19 outbreaks in healthcare settings in Niagara. Throughout this page and on others, you'll see various bar graphs and interactive features. If you're using a desktop, hover over the elements of the graph to view numbers and other relevant information. If you're using a mobile device, click and then hover over the elements. Some graphs include the ability to filter by categories or filter between graphs. For graphs that allow filtering by category, selecting the category from the pick list will update to show the graph by what is selected. More than one category can be selected. Clicking on chart elements will trigger filtering between linked charts. Results from filtering between graphs update the linked charts to show the portion of selected element. On this page, for example, the Cases by Date Reported graph includes a toggle bar that will allow you to compare data between certain dates. Use the bar to narrow down or widen your dates, or select specific dates using the calendar. The Vaccination Statistics page provides key indicators used to measure the progress of the COVID-19 vaccinations administered by Niagara Region Public Health. Again, if you click on Help in the top right corner of the page, you'll be able to view the overview, definitions, and data sources for this particular page. An important definition to consider is total doses wasted. This is the total number of doses that were not able to be administered. The most common reasons that a vaccine is wasted include that it was damaged, lost, or destroyed. On this page, you can also view statistics for total doses administered by date, percent of qualified residents with first dose administered by facility, and more. The Provincial/Monitoring Indicators page provides an overview of COVID-19 case and outbreak information that is used provincially to determine which of the 5 zones Niagara will be placed in. This data is also used locally for decision-making. The indicators and thresholds include virus spread, health system capacity, and public health system capacity. The Epidemiological page provides additional information on COVID-19 case and outbreak statistics over the duration of the pandemic in Niagara. As mentioned earlier, if you hover over the elements of the graphs, you can view numbers and other relevant information. Some of the statistics highlighted on this page include cases by age group by date reported, cases by symptom onset date, and percent of new cases that have no known exposure. It's important to know there are some limitations to the data we're providing. For example, When a case is assigned to a municipality, this reflects the municipality where they currently live and are self-isolating. This does not mean that they contracted COVID-19 from this municipality, so you should interpret with caution where we're seeing cases by municipality. The risk we all experience is actually from the cases that haven't yet been identified. The ones that are unknown in the community, and we have no idea, of course, how many there are. By the time cases are reported to public health and have been updated on our website, it's been about 2 weeks since someone actually became infected with COVID-19. After transmission, it typically takes about a week before you become ill, a couple of days to contact your healthcare provider and get tested, and a few more days before you receive your test results. It can be even longer than 2 weeks if there's been some delays before it actually appears in our data. Ultimately, what we're seeing in terms of active cases or total cases isn't a reflection of where the risk is right now in the community. The main takeaway is that we must continue to take COVID-19 seriously. Every municipality in Niagara continues to be affected by the virus, and we want to ensure we're not creating interactions that allow the spread of infection. We're all in this together and need to continue doing our part to take the necessary precautions to keep ourselves and our communities safe and healthy. Continue to practice physical distancing, wash your hands thoroughly and often, take precautions, and stay home with the exception of essential purposes. We hope everyone finds this new data informative and takes the time to explore the interactive features as well as the other data we have available on our website.